What's up, family? Today I got 3 tips for you guys on how to overcome that chronic lower back pain and chronic knee pain. Let's get to it. Tip number 1. Don't focus in on the area of pain, because oftentimes the site of pain does not equal to the site of dysfunction. Let me explain that. People always ask me, Justin, I have back pain, give me an exercise for my back. Or I have knee pain, give me some knee exercises. Now I just want to pull all my freaking hair out. To explain the concept to you guys of the painful site not necessarily being the site of dysfunction, I'm gonna use this little band right here. So I'm gonna wrap this around my neck and I'm gonna pull right here. So I feel the band's tension in my neck right here. I feel the pain right here. The discomfort is right here in my neck. But is anything really wrong with my neck? No. The cause of this dysfunction is coming from the pulling that's going on over here, and it's being transmitted through this band into my neck. Our body, our kinetic chain often works the same way. We could have an imbalance in one joint, and that imbalance could transmit up through the system or down through the system to another area and cause the pain there. For lower back and knee pain, the site is usually the core, which brings me to my second tip. My second tip for you guys is going to be work on your core. So when I say I want you guys to work on your core, it doesn't mean I want you in the gym doing a bunch of sit-ups and crunches, trying to work on that six-pack. No, that's actually contrary to what I want you to do. What I consider the core of your body is this whole region. If you think about it, right in here, about a few inches below your belly button and inside is your center of mass. So I consider the hips, basically the hips, the lower back, and the abdominal is your core. And that's the area you gotta strengthen if you're dealing with any musculoskeletal issue, but especially knee pain and lower back. I'm gonna go ahead and show you what happens to the rest of your body, specifically your lower back and knees, when you have a weak or dysfunctional core. So what happens is your hips usually tilt anteriorly or posteriorly, back or forth. And what that does is, one, as you can see, it changes the curvature of your lumbar spine, your lower back, and also when my hips move, it changes the position of my knees. So what I see is most common in people is they have weak, deep abdominal muscles, which leads to an anterior tilt of their hips, which leads to an excess curve in their lower back, and valgus knees, which means their knees cave in like that. Now that you know how a bad core is going to destroy your body, I want you guys to start taking core training more seriously. That doesn't mean start doing more sit-ups or crunches. Spinal flexion like those is not going to be very beneficial for you. I would say focus on exercises that involve core stabilization, isometric core strength, things such as planks. Dead bugs are one of my favorite things. I have a video on my channel from a long time ago. Go ahead and check that out. And there are other great videos out there, but remember, focus on stabilization of the core. And my third and final tip for you guys today is to be conscious of how you're moving your body. It's very common to see people go into physical therapy clinics, go into the gym, do a bunch of exercises to improve their posture, rehab their joints, but then they go out in everyday life, they sit like this, they run with their knees going in, they're not aware of how their body is moving the other 23 hours of the day. You can go and do all the rehab exercises you want, but if you're not aware of how your body is moving the rest of the time, it's serving no purpose. You're still moving with those faulty mechanics that caused that pain and injury in the first place. So I really want you guys to start becoming more aware. You can do this by just going for walks, focusing on your breathing, practicing different meditation techniques, or just really focus in when you're working out. Maybe unplug the headphones for a bit. When you're going for a run, take out the music and just focus in on your body. The more you get in tune with how your body's working and running, the more you're gonna be able to control your joint mechanics, and the more you're gonna be able to stay away from injuries, especially lower back and knee pain. So I hope you found those 3 tips helpful. Please implement them into your life. It is gonna help your rehab process. And if you like this content, subscribe up there. The video quality and content is only getting better from here. Check out my other videos, and you can also follow me on Instagram as well at JustinIraniTraining. Till next time, peace out.